5 Back-to-school safety tips during the COVID-19 pandemic. Returning to school has taken on new meaning and a new set of worries for parents and carers during the age of coronavirus disease 2019, COVID-19. Being prepared for a variety of schooling environments can empower you and your child and reduce anxiety. In each case, there are steps you can take to reduce the risks of COVID-19, help your child feel safe and make informed decisions during the COVID-19 pandemic. 1. Practice safe distancing. Social distancing, or physical distancing, is the practice of allowing enough space between individuals to reduce the spread of disease. During the COVID-19 pandemic, steps to encourage social distancing during in-person schooling may include eliminating lockers or grouping them by student groups or cohorts, creating one-way traffic in school hallways, using outdoor spaces when possible for instruction, meals and recess, reducing the number of children on school buses, spacing desks out and having them all face in the same direction, using physical barriers, such as plexiglass shields and partitions, to separate educators and students, dividing students up into distinct groups or cohorts that stay together during the school day and reducing interaction between different groups. 2. Wear a mask. World Health Organization recommend wearing cloth face masks in public places where it's difficult to avoid close contact with others, and schools are no exception. This advice is based on data showing that people with COVID-19 can transmit the virus before realizing that they have it. If your child's school requires or encourages the use of cloth face masks, consider these tips. Wearing cloth face masks should be a priority, especially when it's hard to maintain social distance, such as on the bus, at carpool drop-off or pickup, and when entering the building. Have multiple cloth face masks available for your child. Provide your child with a clean mask and backup mask each day and a clean, resealable bag for them to store the mask when they can't wear it, such as at lunch. Label your child's mask clearly so it's not confused with another child's. Practice properly putting on and taking off cloth face masks with your child while avoiding touching the cloth portions. Remind your child that they should clean their hands before and after touching their mask. Instruct your child to never share or trade masks with others. Talk to your child about the importance of wearing a face mask and model wearing them as a family. Discuss with your child why some people may not be able to wear face masks for medical reasons. Don't place a face mask on a child younger than age 2, a child who has any breathing problems, or a child who has a condition that would prevent him or her from being able to remove the mask without help. 3. Keep hands clean. Practice hand washing at home with your child and explain why it's important to wash his or her hands with soap and water for at least 20 seconds, especially before and after eating, coughing/sneezing, or adjusting a face mask. To prevent rushing, suggest washing hands for as long as it takes to sing the Happy Birthday song twice. When hand washing isn't available, suggest that your child use an alcohol-based hand sanitizer that contains at least 70% alcohol. Also, explain that he or she should avoid touching his or her eyes, nose, and mouth. 4. Clean and disinfect. Cleaning and disinfecting frequently touched surfaces can help reduce the risk of illness. This includes frequently touched items such as doorknobs, faucets, keyboards, tablets and phones. 5. Stay home if sick. You should monitor your child each day for signs of COVID-19. These include fever, runny nose, cough, fatigue, muscle aches, vomiting, diarrhea. To limit the spread of COVID-19 as well as other germs, children should stay home from school and other activities if they have any signs of illness or a fever. Contact your GP if you have questions. Following these steps can help parents and carers be assured that their child is as safe as possible during the COVID-19 pandemic.